Do you ever feel like you have a million symptoms and no one's really connecting the dots? In functional medicine, we use a tool that helps us see the big picture and map out patterns of dysfunction so that we can get your health back on track. Hi, I'm Dr. Kate Erickson. I'm a board-certified internal medicine physician, registered dietitian, and integrative and functional medicine specialist. And today we're talking about one of my favorite tools, the MSQ, or Multiple Symptom Questionnaire, and why it's so much more than an intake form. You've probably filled out an MSQ before. It's that long intake form that has you write your symptoms down from head to toe, everything from headaches and insomnia and dizziness, heart palpitation. You get the idea. Here's the problem. In conventional medicine, we're trained to think of the body as a series of systems, and each system can go awry and produce a series of symptoms. When a patient comes to us and they have symptoms across nearly every category, we start to feel overwhelmed ourselves as doctors, and we say, gosh, usually that leads to 10 different referrals and 10 different prescriptions. This does not address root cause medicine. This leaves you feeling lost and like no one is connecting the dots. I get it. I was trained in that system. A 15-minute office visit makes root cause care nearly impossible. But in functional medicine, we look at your symptoms differently. We use a systems biology approach. Instead of looking at a series of different symptoms across multiple systems, we think of things differently. We look at patterns of dysfunction in order to truly identify the root cause. When a patient has multiple symptoms across various systems of their body, it usually means that there's a number of upstream or root cause imbalances, and we see that as an opportunity to dive deeper. The most common upstream issues that I often see in my practice are energy production issues, nutrient depletion, toxin overload or issues with detoxification, immune system dysregulation, and gut imbalance or permeability. By looking upstream, we have something that conventional office visits rarely allow for: clarity, direction, and a true roadmap for healing. So where does that roadmap start? In functional medicine, we always start with diet and lifestyle. These are foundational tools that are essential for optimal health. Our dietary and lifestyle patterns have the strongest impact on our overall health. And the good news is, these are often affordable interventions that you can start right away. You don't have to dive in with really expensive tests or really complicated protocols. Oftentimes, just starting where you're at and making small changes can have a huge impact. By building up your foundation through dietary and lifestyle principles, you can powerfully transform your health. So I invite you to ask yourself 2 questions. Number 1, my health would be better if I ate more blank. And number 2, my health would be better if I ate less blank. These questions sound simple, but honest answers to these questions are often more insightful than complicated lab testing. We each have an intuitive sense of where we're falling short and what we need to do to improve our health. So I invite you to dive deep and do some internal reflection. Where are you at in your health, and what do you really want your health for? Finding these intrinsic motivations can be key for initiating behavior change. So what's one action step that you can start today in order to move the needle? Maybe you're at level 1, and all we need to focus on right now is adding more hydration. Drinking an adequate amount of clean, filtered water is one of the best things that you can do for your health. Hydration supports digestion, detoxification, and energy production, and most people are chronically underhydrated. There's an epidemic of chronic kidney disease, and chronic dehydration is one of the primary root causes. So how much water should you aim for? Well, that's a pretty personalized decision, but in general, for most men and women, shooting for between 2 and 3.5 liters of water per day is a good place to start. Obviously, you need more if you are exercising, sweating a lot, live in a hot, humid climate, but in general, most people could strive for drinking more water. Okay, so you're doing a wonderful job staying hydrated. Let's add more phytonutrient-rich foods to your diet. Phytonutrients refer to those colorful pigments found in fresh fruits and vegetables. These are powerful compounds that help reduce oxidative stress, lower inflammation, improve metabolism, and may reduce the risk of cancer. Phytonutrients are typically organized according to the color: red, orange, yellow, green, blue or purple, and lastly, tan or white. Take a minute and do a mental survey of what you had to eat yesterday. How many servings of orange foods did you have? How many servings of green foods did you have? What about purple or blue or red? Try adding those up and see how you did. This can be a great activity to do along with kids, and it's just a great inventory to check in and see how are you really doing. Aim for 6 to 12 servings of phytonutrient-rich foods every single day. And it's important to mix up the types of foods that you're getting. Variety is key. Our bodies thrive when we have a strong variety of fresh fruits and vegetables. If you're looking for a tool to help you track your phytonutrients in your diet, functional medicine providers often use a checklist with their patients. This is a simple tool that you can print out and use over a few days to see how you're doing. I know these interventions sound simple, but they truly are transformative. If you're looking to heal your body from the inside out and look upstream, starting with your diet and lifestyle are absolutely critical. My hope is that through this channel, we can break down functional medicine principles so that we can look upstream, find the root causes, and empower each and every one of you to take control of your health so that you can live your best life, because you're worth it. If you found this information helpful, please like and subscribe. It really helps this new channel grow and others find this content. Again, I'm Dr. Kate, and thanks for watching.